He coined the term "your health is your wealth" in 1860. I am here visiting the Republic of Zimbabwe, led by his namesake Emerson Mnangagwa. And here, I'm slowly learning that your wealth is actually your health. Let me explain. The past 2 decades in Zimbabwe have been marked by hyperinflation, which now stands at 191%, unemployment, and the massive exodus of young Zimbabweans in search of greener pastures. Resources in the public health sector are spread thin.
When I was pregnant, I went to the hospital. I was in labor for 4 days. Then when I delivered, I discovered that the child has already died. After giving birth, I wasn't given any medication.
At this private clinic in Avondale, Harare, 40-year-old Wellington Mahohoma has come to get his blood cleaned through dialysis. His kidneys have failed, and the only way he can live a healthy, normal life is by having this procedure twice every week. But this is wiping clean his bank account.
On average, I've been spending close to $1,700. Dialysis is free in government hospitals, but we tried to get dialysis done in public hospitals because definitely it was going to help me save money. But if you look at Parenia, for example, is one of our biggest hospitals, you will see that they've got 17 dialysis machines. But out of those 17, currently only 3 are working. Each session is either 4 hours or 5 hours. So how many people are going to be saved on a day with 3 machines?
A 2021 UNICEF reports indicate that the government of Zimbabwe is falling far behind the Abuja Declaration target, requiring AU member states to allocate 15% of their total annual budgets to the health sector. Public hospitals here are acutely underfunded, understaffed, and under-equipped.
We have the budget to support the repair of machines, and we are purchasing additional equipment in the health sector. And so this is not an issue that we are unable to resolve. We are resolving it. We are working on it. But mind you, the gap in the health sector was so huge when we came in 3 years ago, almost 4 years ago now. And we are dealing with that gap. And as I said earlier, the pandemic also, in a sense, squeezed out other programs within the health sector as we had to focus on it squarely to save lives and also save the economy as we went about it.
It's very difficult, especially you've got kids who need fees to be paid. You need to buy food, you need to pay rent house. So sometimes you have to make a choice. Should I go to dialysis or should I buy food for my family?
According to Zimbabwe's Health Service Board, over 2,200 medical personnel resigned in 2021 alone. This included 900 nurses. Until 2021, Samson Gurupira was a senior psychiatric nurse and an organizing secretary at his hospital's Nurses Association. His humble residence here in Harare's Southampton residence speaks volumes about his frustrations, but he's trapped.
I feel worthless and useless and regretting to a certain extent. If you compare the salary scales of health workers in our SADC region, for example, in South Africa, a nurse earns at least around 30 to 45,000 rands a month. A doctor earns even double the amount that I've said. But in Zimbabwe, they are earning below 200 to 150 US dollars. That money it doesn't make sense for a professional. The process for a nurse or a doctor to leave Zimbabwe, it can cost roughly something like 1,400 to 1,700 US dollars. And here in Zimbabwe, it's not easy to acquire that money, especially if you are working at a government institute. To work harmoniously and wholeheartedly, you must not be stressed psychologically. for you to execute your duties properly. But if you are stressed, then somehow, you end up inflicting complications on your patients, or you end up protesting, or you end up not going to work, or even doing some of the things that are unscrupulous, or stealing from the hospital, or stealing from the patients, which is not proper for a professional.
Being foreigners in Zimbabwe, 60-year-old Ziva has been driving us around. I have come to learn that he is living with constant knee and ankle pain.
I went to the hospitals, but they didn't give medication.
Since 2017, Ziva has taken approximately 4,380 painkiller tablets.
I survived with painkillers.
For Ziva, who continues to buy painkillers daily, Wellington, whose dialysis is draining his bank account, and Mutuanyika, who lost her newborn because of her shallow pockets, wealth is health and not the other way around in Zimbabwe.